Hello friends, welcome to our show. A lot of women are facing various health problems these days. One of them is adenomyosis, which is a very common problem in women healthcare. Let me introduce Dr. Pradeep Mule, Senior Consultant Interventional Radiologist practicing in New Delhi, India. Welcome to our show, Dr. Mule. So Dr. Mule, there is a lot of women health problems which are very common these days. Adenomyosis is one of those problems. So I would like you to tell our audience what is exactly adenomyosis.
See, the adenomyosis is the non-cancerous conditions and which mimic like a uterine fibroids.
Okay.
Most of the time the symptoms of the adenomyosis are very similar to the uterine fibroid.
Okay.
When you talk about what is exactly the adenomyosis, you know the internal lining of the uterus, which the cells from the lining which penetrate into the muscles of the uterus, and that grows inside. Once this grows inside, the size of the uterus that become a little larger, and once this menses cycle comes, so because of the bleeding also comes into this lining into the muscle wall.
So that swells up.
That's why the uterus also swells up. And because of this bleeding into the muscles, so there's some irritation comes and something comes, right? And because of that, the fibrotic tissue develops. Once this diffusely go into the muscular wall of the uterus, so this may be sometimes only the one area, so that is the focal adenomyosis. May sometimes this happen in so many 1 or 2 or 3 or 4 areas.
Diffused.
This is the diffuse, right? So this may be the diffuse. In diffuse, normally when you see the uterus size is become around like 12-week pregnancy size.
Okay.
Right, and how to know that this is the fibroid, right? This is the fibroid and this is the adenomyosis. The adenomyosis, when you touch the abdomen, so this always be the little tender and the painful.
Okay.
So this is the adenomyosis.
Okay. How to differentiate between the symptoms of adenomyosis and fibroid? What are the particular symptoms of adenomyosis?
In adenomyosis, one is the very different symptom from the fibroids. The intense pain comes. Once the menses is going to be start 3 days, 4 days, 5 days before the pain starts, that's the triggering point, right? And that time we assume that this is adenomyosis.
Okay. Talking about the diagnosis, how to diagnose that one is suffering from adenomyosis and not with fibroid?
See, when the patient comes with the heavy bleeding and the clots and the intense pain during the menses and before the menses. So normally in a gynae examination, the uterus size is enlarged, and the tenderness also there. Tenderness means when you touch the uterus on examination, that is a little painful. So this is the one manually you can diagnose also. But furthermore, you wanted to diagnose this thing, so you need a transvaginal ultrasonography.
Okay, the internal.
Internal ultrasonography. Internal ultrasonography, that is the very cheap way to less expensive also, so you can diagnose very easily also, and this modality is available most of the places. If any confusion comes on ultrasonography, like this is the fibroid or adenomyosis, then you can ask the patient for a MRI. MRI is the magnetic resonant imaging. MRI is the little higher modality and little more expensive also, but MR on adenomyosis is the really great. Because you can do on MRI the tissue characterization. You can differentiate that this is the fibroid, this is the adenomyosis. Even you can classify on MRI the adenomyosis, the type of adenomyosis. Is it diffuse adenomyosis, or maybe the multifocal adenomyosis, or maybe just the one spot of the adenomyosis. So MRI is the wonderful tool to diagnose the adenomyosis.
Dr. Mule, I must appreciate what you are doing for such people who are not really very ready to undergo the surgical treatment. And really thanks for sharing this much information, this much important information for the people suffering from such kind of problems. Thank you.
Yeah, thank you very much.